It is always a privilege, and we are joined by the Florida Attorney General, Dr. Joseph Ladapo. He is a Harvard-trained physician. He's an internist. He has a PhD from the Graduate School in Health Policy at Harvard. He has a book, Transcend Fear, a blueprint for mindful leadership in public health. You can follow the official Surgeon General, Florida Surgeon General government account at X, FL Surgeon Gen. FL Surgeon Gen, easy enough. So he and I always have a lot to talk about. It is, again, a profound privilege when he joins us, and he will be here again. He's made some headlines recently for calling into question the wisdom of a continued distribution of the mRNA vaccines. We'll talk about that right after this. Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say. Valentine's Day is around the corner, so it is time to look your absolute best. Our friends at Genucel are celebrating Valentine's Day with a special gift just for you. From now until Valentine's Day, get a limited time gift of beauty box free with your order at Genucel.com/Drew. Each beauty box has 2 of Genucel's top sellers for you to give a try. It's absolutely free. And right now, save over 60% off all of our favorite Genucel products with one of our customized skincare packages.
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. Retinols, vitamin C cream, under eye cream, night creams.
Scrubs.
And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com.
Plus, with its immediate effects, Genucel promises results that will make you smile. It's guaranteed or 100% of your money back. To let yourself and a loved one with our limited edition bundles right now at Genucel.com/Drew. Use our special code Drew at checkout for extra savings off your order today. And remember, every order placed is automatically upgraded to free shipping. Don't wait. That is Genucel.com/Drew, GENUCEL.com/DREW. As a physician, I am deeply concerned about efforts to erode the doctor-patient relationship. And as medical freedom continues to come under assault, I'm on a mission to empower you to be able to take care of yourselves and your family the way you want to. I urge you to get this medical emergency kit from the Wellness Company. It contains essential prescription medication you should really always have on hand. Here's Dr. Peter McCullough, Chief Scientific Officer.
It's a very broad and diverse medical kit, can handle everything from a urinary tract infection, a fungal infection, a bronchitis. People can, via telemedicine, get their questions answered and get on the right track. But it's basically an at-home formulary. Yep. For the first time, people, instead of being held captive by an urgent care or by a doctor's office or an ER, they can actually do this themselves at home.
Save yourself the wait and the hassle and feel better faster. Go to drdrew.com/TWC for 10% off. That is drdrew.com/TWC for 10% off the medical emergency kit. All right, as I said, Dr. Ladapo is a Harvard-trained physician, UCLA. He was, I think, a professor there. He's now at University of Florida. Let me double check, make sure I'm getting the institutions correct. University of Florida College of Medicine, where he's a professor presently. He has a PhD from the Harvard Graduate School as well. And worked, let's see what this says, Associate Professor of Internal Medicine Health Policy Research at UCLA. So that's when he was over at UCLA. He's always a pleasure to talk to, and it's a privilege to share the screen with him. So let's bring in Dr. Joseph Ladapo. There you are. Hey, Joe, how are you doing?
Hey, Dr. Drew. Doing great. Always a pleasure to speak with you.
So since we last spoke, you stirred the pot a little bit. I thought that was interesting. How has it been since that effort on your behalf?
Honestly, Dr. Drew, it feels great. I am always grateful when we do something that is truthful and frankly aligns with a lot of people's intuitive relationship with truth. And we get to speak for them. We get to speak in an area where they haven't felt heard. We did it when we made the announcement about the pediatric COVID-19 vaccine for healthy kids, which was a completely ridiculous, no data-based recommendation that the CDC and most of our colleagues were making at the time. We've done it a number of times since then, and this was just another time where we made the right call, absolutely the right decision.
So I want to kind of dig into that. Did you see before the mics heated up here, we sometimes play a little video clip of previous shows, and some of you may not have seen that, but did you see Dr. Joseph Fryman in the clip leading into this? Were you listening to that? Yeah. Do you know Joe? Do you know him?
I know Dr. Fryman, and I love the Samsung.
Okay.
He's
okay.
I mean, I don't think about that. Right.
I just want to make sure you were talking to him, because every time I speak to him, I just walk right going, oh my God, things are worse than I thought. And he's a very sober, circumspect, careful clinician and researcher, and his team is very similar, but he has grave concerns. So my first question, since Fryman is top of my mind, why aren't we going back and doing the research we would normally do on these vaccines? I understand they were rushed to market. I don't object even that they were rushed to market. It was an unclear time, fog of war, probably really did some good in the long, but why not now go, okay, hold up everybody. Let's go and by the way, we have other options. If you need a vaccine, we have Covaxin. We have other things, whole viral options that are out there. What is wrong with the CDC that they're not educating people about the options, A, and B, why aren't they advocating for the proper research to be done on the mRNA vaccines?
Oh, that's actually a very easy question, Dr. Drew, to answer. And it comes down to pardon me, maybe it's hard to answer. It comes down to
say it. Easy to answer, but hard to say it.
It comes down to reputation. It comes down to institutional confidence and all sorts of other BS that fits in the same category. That's all that comes down to. Saving face, all of that. We want you to keep believing in us. And we're afraid that if we tell you that we made some decisions that were wrong, you will no longer believe in us.
That is... I need to know your evidence for that, because that's such an astonishing thing. The idea that they would allow people to even potentially be harmed out of concern for their own ass. Are there people you're in government? Do you have evidence? Do you hear it behind closed doors? You don't have to give me the specifics necessarily, but yes, you've spoken to people. You can confirm there is evidence of this BS, as you say.
Well, this is the type of evidence you need is when, some guys who are on spring break see a beautiful woman on the beach and they look at her and they're looking at her because she's beautiful. You didn't have to ask them to have a pretty good idea of what was going on. In this particular case. So
I will just say before you go on, just because our wives are listening, certainly my wife's listening. I have no idea what you're talking about. So anyway, keep going. So
well, I don't go on spring break anymore. I'm too old for that.
You don't go to the beach. You don't go to the beach.
Yeah,
I've interviewed your wife before. By the way, she is lovely. But on Joe's behalf, I'm here to confirm he doesn't go to the beach anymore.
Yeah, we're talking about other people here, not you and me.
You're right.
It's just basic human behavior. When the evidence piles up and you continue to see them doubling down, tripling down.
Yeah.
Meanwhile, Americans are going the very opposite direction. There's been almost no uptake of this COVID-19 vaccine, the new one, kids. There clearly is a disconnect. And here's where the people are, because they see what's clearly in front of them, which is that, for example, this doesn't benefit kids and it may harm them. But they don't want to yield anything because they don't want to sully their reputation and sully the confidence in the vaccine program and things like that.
Not only that, there is a very strange, I think there's an epiphenomenon to what you're describing. This very strange phenomenon where I've noticed that clinical impression, clinical experience, which was always, I wouldn't say it was the gold standard, it was certainly a guiding I mean, when we went to medical school, we listened to our attendings, and the attendings would tell us about their experience. And hopefully, eventually, the research would confirm the experience. But there is some extraordinary, almost religious energy around RCTs, around randomized controlled trials, and a complete disavowal of clinical impressions or the public's experience, what the patients tell us they're experiencing. People just push that aside. Thus saith the Lord is an RCT. And let's remind ourselves, RCTs have only been around for about 75 years. Before that, we invented antibiotics, and they worked. And with clinical experience, we learned about their side effects and where to apply them. We didn't have RCTs until 75, 80 years ago. What's going on, do you think?
It's a great point, and I think there are a number of points of disconnection here, Dr. Drew. One of the major points is that there was and remains so much investment, and I don't mean financial investment. I mean reputational investment, belief investment, like existential investment in their COVID-19 vaccines. And in the vaccine architecture in general, that there's not enough interest. Like if you only want to see good or bad in someone, it's hard to see the opposite, even when it's right there. So that is a major part of it.
But our peers, our profession normally is very circumspect, and we have to go back over things a million times before we sort of arrive at a consensus. And all that is being suppressed even within our profession, is it not?
Totally. I mean, and it's interesting. I mean, we may have even talked about this a little bit before, Dr. Drew, but people should know that there's been this shift in doctors moving from private practices, being their own boss to the extent possible, to being employees of hospitals, to being employees of large clinic systems. And that's not a subtle thing. It's a major thing. And one of the things that comes with that, beyond the loss of autonomy, which is probably the biggest contributor to why so many doctors are unhappy with their profession now. But the other thing that comes with it is loss of voice, loss of being able to say what you believe is true. And there's an overwhelming urge to just not stick your head out, not take risk, not say things that are out of place. And that has clearly been a pattern. And we've seen people, unfortunately, lose their heads when they've said things that were against what the CDC and the FDA were saying.
Yeah, that was one of the big shocks to me from COVID, was how much our peers were employees and just fell right in line with whether it was the insurance company or the hospital group or the medical group, whatever it was. They just said, okay, and just did not represent the patients the way we normally think of them. The other thing is happening. I don't know if you saw I don't even think it's out in print yet, but I think yesterday or the day before, I get these email initial publications, and JAMA this week, I was reading and I thought, oh my God, there's almost no medicine. It's all social engineering. In fact, to the point where they're saying physicians now have a responsibility to make sure there is wealth distribution, to make sure that health outcomes are maintained as a result. And I was thinking, oh my, what do I know about economics? Who am I to make a call like that? That's social engineering. You want physicians now to be social engineers? I don't know, but that's echoes of very bad chapters in history, it seems to me.
Yeah, and climate warriors. We've seen, like in the New England Journal of Medicine now. I don't know if you read the New England Journal of Medicine regularly.
Every 2 weeks, regularly.
If you looked over time, the number of articles about doctors' role in fighting climate change and hospitals' role in fighting climate change has just been climbing over the last few years. And it's just all this buy-in to whether it's this diversity, equity, and I don't even know what I'm sure. I think my brain's wiping it out. But this buy into this belief system about how the world is supposed to look it's seeped into every crevice of academia, and it's bad for academia. It's bad for freedom of thought. It's suffocating, and frankly, it's wrong. I mean, the diversity, equity, and inclusion stuff is actually, so much of it is immoral, right? UCLA, their medical school. I was reading an article the other week. They had a planned activity for medical students that separated people by color into different groups. And unfortunately, they were called on it by a physician organization and canceled it at the last minute. But it's so profoundly immoral. I mean, this is how drunk they are in the Kool-Aid and how underwater they are in it.
I'm glad you're laughing, but my take on it is it shouldn't matter where you as a doctor fall in your enthusiasm for these ideas. Practicing medicine is hard. Staying up with the literature is hard. Moving the profession, the science forward is hard enough. Not that we should be also social engineers and economists. That's not our thing. Now, we can represent healthy fill in the blank, but we shouldn't be advocating, making decisions. I mean, go ahead and, like yourself, go into politics, whatever, that's fine. But for it to take up space in my academic journals where I'm looking for novel treatments for new, myeloma cases, RFK Jr. says the first thing he wants to do if he were to be elected was to call in the editors of the three majors and tell them they're going to be prosecuted under a RICO law for their clear collusion on these issues, and also how they're representing the usual back and forth about things like vaccine therapy and risk and whatnot, which in his words, is not being represented. It all goes one way. That's how you can tell it's being editorially cut out, because science never goes just one way. It just doesn't.
Yeah, no, you're totally not true.
So I'm singing to the choir. So the other thing is that I was thinking. I was thinking about my own relationship with the CDC, and when COVID broke out, I could see the panic being fomented, and at the time I thought it was the press. I thought they were up to it. I know how they do things. I know they're ruthless at whatever they have to do to get viewers, even if it means freaking you out. They'll do it. And so I thought, it's the press. And I was chanting over and over again, don't listen to this. Don't listen to it. Stop it. And I got too aggressive with it. I have to, maintain humility always in relation to any information and try to, I could be wrong, of course, always in all things. And I've sort of reminded of that. But the one thing I said that was edited from everything you'll see about me around that period of time was, this is nothing. Don't worry about it. Calm down. Just listen to the CDC and Dr. Fauci. They will get us through this. And I was thinking at the time, I'm remembering now, I was thinking, certainly these will be calmer heads. These will be the sources of cooler information who understand that panic is never improves things. And instead, the reality is they did the opposite. Now we have emails where Fauci was, advocating for using fear. And to me, that was such an ethical violation and ill-advised, obviously, but such a profound ethical transgression. I'm shocked we're not talking about that more as a profession.
Oh yeah, no, you're absolutely right, Dr. Drew. I mean, the use of fear for any purpose, it's a frequency that is the opposite of our alignment to our higher selves, our connection to God. And I know that's not quite a medical take on it, but it really is. It's anathema to who we are, because as beings, we aren't fearful. We're fearless. We're not we're not anxious. We're naturally peaceful and calm. We're not frustrated. We can have that's not a natural, those aren't natural states. We can be excited, we can be energized, but those are more natural states. Those are states that, again, are more in alignment with our connection with our higher selves and God. Not fear, not anxiety, not jealousy, not hatred. None of that stuff is in alignment. And I talk about some of these things in my book, Transcend Fear. And it's not good for human beings, and it's also not good for public health. And the not good for public health part has been known for many decades, probably hundreds of years.
And to be fair, I look for every opportunity I can to apologize for my own participation in some of the fear-mongering we did during the HIV epidemic. Now, let's be fair, that was an illness with a 100% fatality rate. Now, 1%, 100%. It was bleak and terrible, and we scared a whole generation of high school students, told them, they're going to get AIDS, if you don't use a condom, or if you have sex with one person, it's with everybody they've ever had sex with. Yeah, okay. And in fact, what people are saying now is that Fauci and friends, Birx in particular, took a page. Jay Bhattacharya said this to me. He said that they were hearkening back to the HIV playbook, which was also frankly wrong. And I want to apologize for my participation in it, even though we congratulated ourselves for 200,000 dead as opposed to 3 or 4 million dead, which we were anticipating. And it's just wrong. It's just flat out wrong. And I want to apologize whenever I can for my role in that. That was wrong, misinformed. I was young. I was listening to Fauci and all, and we thought we really thought we were doing something good. But it really highlights the fact that social ills, social evil, when it is perpetrated, this isn't the worst of social evils, evoking fear to try to improve a public health outcome. It's not the worst, but it's not good, and it's ethically inappropriate. And whenever there's a social evil, it's always in the name of doing good. I'm the good guy. I did it. I know what it felt like, and I was wrong. It's always in the name of doing good. And so I am deeply concerned right now about everybody who thinks they're so right and so good and so righteous, and the incredible evil they could bring if we are not careful.
Well, Dr. Drew, actually, I really want to commend you. I mean, your sincerity is heartfelt, and it's wonderful and beautiful, right? It shows your humility that that it's more important to you to have integrity than to care about how someone's going to react to something that you did or I wasn't really listening back then, so I don't know exactly, because there is a difference between just saying what you think is true and saying something that is
true. You're right. You're right. No, thank you. I'd not thought about that. We did think it was true, and we thought we needed to we knew we were making people frightened, but we felt like because it was true, it was appropriate. You're right. Thank you for that. That kind of clarifies my experience.
Yeah, it's interesting that you're saying that, Dr. Drew. It actually, because sometimes things are terrible, and HIV was terrible. I mean, so many people.
Oh my God, it was awful.
Died. And it's important that people have the right information, but it's also important, ironically, or in some ways it's ironic, that at the same time, people have a right to make bad decisions. And that doesn't condone people's bad decisions, but it does show respect for their sovereignty. And so if I give you accurate information and you still, that's where my role ends, is to provide you with accurate information to support you in as much as I can in the pursuit of health. Where a person can cross the line is when I start using that information and that delivery of information to change your behavior, not to let you make your own decision about changing your behavior,
right?
But actually with the intent of changing your behavior. That's right. The key difference. That's obviously, Dr. Fauci was neck deep in that throughout the pandemic when on TV telling people things. That was obviously his goal, and that's why a lot of people, he has elicited a lot of hate for that reason, because people hate that. People don't like being manipulated, and people really, really don't like being manipulated. They don't like it because it's an assault on their autonomy.
Yeah, I'm shocked. I am really shocked that people don't know their history. I'm looking at where is that? Looks like it's YouTube on Restream. In 1984, when I was taking care of AIDS patients on a regular basis, and all the way through my residency, AIDS patients were a common thing that residents and medical students took care of, like many, many, many hundreds of them. And there wasn't a day that went by that I wasn't telling a young male that he had 6 months to live, and I was never wrong. Never. It was bleak. It was dark. I saw Burkitt's lymphomas literally tear people in half. I saw PCP that was untreatable at that time. We didn't know how to treat it. We had ways we didn't know yet. We found them finally. But even then, even with the protocols that developed, we expanded life expectancy from 6 to 12 months. It wasn't until we had the antivirals that came 10 years later, well, maybe 8 years later, that turned the illness into a chronic condition, which it is now, thank God. But at the time when I was taking care of AIDS patients hand over fist, I was telling them regularly they had 6 months to live, and I was not wrong. It was bleak. It was terrible. Oh my God, it was terrible. You can't imagine. No one's around to talk about it either, because they no one's around. They all died. They all died. Go watch the documentaries on Studio 54 and things that were going on in New York at the time. You will see the generation of wonderful, talented young people we lost, artists and performers. It just was bleak. And thankfully it ended. Okay, well, listen, here's what I want to do. I want to take a little break, and then I want to come back and talk vaccine. I want to get deeper into the vaccine conversation and what you think we should do there and what your concerns are about it. And there's a lot there. I'll have you think about this maybe during the break. One place I want to start is, let's say there's no risk to the vaccine or no nominal risk to the vaccine. Why push so hard on a vaccine for an illness that is so benign? It's sort of just super hard for me to understand that, particularly for young people. But we'll get back to that when we return. Dr. Joseph Ladapo, be with you after this. Well, most of my career I've been urging people to kick habits, change habits. Well, this time I'd like to suggest getting into the habit of adding Paleo Valley grass-fed bone broth protein to your daily nutrition regimen. Here's CEO Autumn Smith.
It's made from cows with 100% grass-fed and finished, and bones. They're bones rather than the hide. Most bone broth or collagen powders are made from hides or hooves, but ours is actually made from the bone because it'll contain additional nutrients. Bone broth is a way to bring back those nutrients, those minerals, and there's glucosaminoglycans, and then there's collagen, which helps us prevent wrinkles and joint pain and actually heals our gut. There's gelatin, and there's just all of these ingredients that the modern diet has kind of left by the wayside.
Susan and I have been mixing the chocolate-flavored bone broth literally into our coffee every morning for months, and we've noticed a difference in our energy, appearance of our hair, skin, nails. Susan's particularly very happy with this. The bioavailable protein also helps us feel satiated. That's the part I'm happy with. Paleo Valley bone broth also comes in vanilla and pure, unflavored, and can easily be added to your coffee, smoothies, yogurt. Go to drdrew.com/paleo, P-A-L-E-O, for 15% off your first order. Again, that is drdrew.com/paleo. Are you one of the millions of American women and men dealing with premature hair thinning and hair loss? Or maybe you're scared about inheriting that thinning look because it runs in your family? Start 2024 with a real solution that delivers results without the harsh side effects or unwanted chemicals and no need for prescription. Provia uses a safe natural ingredient, Procapil, to effectively target the three main causes of premature hair thinning and hair loss. By supporting healthy scalp circulation, the delivery of nourishing nutrients, and healthy hair follicle anchoring to your scalp, Provia guarantees more hair on your head than in the shower or on your comb. Right now, new customers save over 50% plus free shipping. Every introductory package includes a full 60-day supply of Provia serum for daily use, plus the Provia Super Concentrate for faster, more noticeable results. Don't wait. Order now to save an extra 10% and get free shipping at proviahair.com/Drew. That's PROVIAHAIR, proviahair.com/DREW. We all know the value of a good night's sleep. We feel better, look better, have more energy to spare, but you could be missing out on all of those benefits if you're sleeping on sheets that are too hot or too cold or just plain uncomfortable. I have the solution. Cozy Earth bedding. Cozy Earth is the softest and most comfortable sheets, blankets, loungewear, and more. They use premium viscose from highly sustainable bamboo, and we sleep in them regularly. I wear their t-shirts. Susan wears their pajamas. Cozy Earth bedding comes with a 100-night sleep trial, which means you have up to 100 nights to sleep on them, wash them, try them out. If you're not in love, just return them within 100 days for a full refund. Susan and I love them. In fact, we have Cozy Earth sheets on our bed right now, and they made a huge difference in our sleep. If you've never tried Cozy Earth, we have some awesome news. You can save up to 35% off Cozy Earth right now. But hurry, this offer will not last. Go to CozyEarth.com, enter my promo code DREW at checkout for up to 35% off on your first order. That is CozyEarth.com, promo code DREW, COZYEARTH, CozyEarth.com, code DREW. We are back with the Florida Surgeon General, Dr. Joseph Ladapo. His book, let's throw it up there full screen if you don't mind, Caleb. It is, there you are. And let's get the book. It is Transcend Fear, a blueprint for medical leadership mindful leadership in public health. And of course, you can see the official X, the Twitter page, which is FL Surgeon Gen. Is that right, Joe? FL Surgeon Gen, is that your X? Yeah, FL Surgeon. Okay, so let's get to the vaccine. I before I pose the question that I was sort of alluding to before the break, I want to go back around on the issue of the proper research with the proper endpoints that were never done. Is it an adequate argument to say that we've had so many billions of doses now issued that is sufficient to at least give people a certain amount of comfort with the safety of the vaccine? I suppose the question would be, would this be the argument against going back and doing the randomized controlled, double-blinded crossover studies that we normally see with vaccines?
Yeah, that is called propaganda, and it's been leveraged by the CDC and the FDA every moment and every opportunity that they have. An analogy would be if I were to get in a tank and I were to drive straight for a mile to get to work and then do the same thing backwards to get back home and not look at all during the whole trip, because I'm in a tank and I just know that it's straight this way and straight back, and do that, every day. And, I didn't see anything. Everything was fine. That doesn't mean everything's fine. I wish I could come up with a more artful analogy, but if you're not looking for it, if you've built an environment where everyone needs to get in line, or they may lose their job, or people may call them bad names in the New York Times or the Washington Post or whatever your local newspaper is, then you can't say you've really done a fair assessment. And that's why this whole billions of people thing is bogus. There are people who believe that millions and millions of people have been injured by these vaccines, these mRNA COVID-19 vaccines. I'm certain that they're correct. And there's data to support that. So that's just propaganda. That's just more the usual shut you down stuff.
Yeah, and of course, as always, it's a risk reward that we're trying to figure out. I would say clinically, I've seen more. Let me think about this. Yeah, I've seen more devastating long symptoms, debilitating long symptoms from the vaccine than from COVID. And yet there is data out there that suggests the opposite. So that, I don't know, it's not been my experience. But it's weird to me that it seems like we can't even, let me ask a more specific question. Are we having excess deaths all over the world or not? Number one. And if so, why aren't they alarm? Why aren't they looking into it as an emergency? That is confusing to me. Or do they know something they're not telling us?
And I think that you raise a great point, Dr. Drew. I think it's important for people to understand that a vaccine or any medication can still do something good while causing harm in other areas. So the question, at least early in the pandemic, isn't whether the vaccines were effective against COVID-19 or people getting seriously ill. That is a question now, and it is completely unclear whether they do anything positive.
Right.
But in the beginning, the data were very good that they helped people not get very sick from COVID-19. But there are people like Dr. Christine Stableman, and there are other researchers who say that, that's not the only question you should be asking, because these vaccines have these other effects on how a person's body works. And we know from prior studies, for example, from studies of the old whole cell diphtheria tetanus pertussis vaccine, for example, that vaccines can be effective against a disease they're directed against, but still actually cause people to die at higher rates. So for that particular vaccine, there have been multiple publications now that provide very strong evidence that, unfortunately, while the DTP was protective against diphtheria, tetanus pertussis, it also increased mortality, overall mortality in girls, more so than boys. So that's exactly the question is not just, does it work for the disease that it's targeted against? That's absolutely the wrong question. You must look at the global picture because our bodies are infinitely complex. And if something happens here, something else is changing somewhere else. And we've got to make sure that other thing that's changing isn't something that's changing for the worse. It doesn't change the risk-benefit calculation. And you mentioned it with excess deaths. There are many people who are concerned that there is a relationship between the mRNA COVID-19 vaccines and the persistent increase in excess death. It's not saying it's the entire thing, but it's saying that there's concern that it's contributing to it.
Right. It could easily be COVID itself, or it could be the effects of lockdowns, but no one is looking into it with the kind of rigor and alarm that they should be. And I can't even, it just blows my mind that people aren't, the UK is tiptoeing in a little bit, but then none of the MPs show up for the hearings. It's just either it's happening or it isn't. Sure looks like it is. And then why, and why aren't we? Yeah, I mean, more people are going to end up from the excess deaths following COVID than during the COVID pandemic by far. Now, maybe it's all due to COVID. I'm ready to accept that. Prove it. What's in there? What's in those excess deaths and why? That's fine. But wow, that it's being sort of, I think it's back to what you said in the beginning. It must be some reputational thing because they're putting their head in the sand, hoping it goes away. But the entire world, every world government is doing it. I can't, am I missing? I wonder what's wrong with me. Something's got to be wrong with me that I'm missing something, that this is the case. I can't believe it. I can't believe it. You're laughing at me, but it's hard for me to believe.
I know, but it is crazy though, Dr. Drew. We are in this, we're still in this alternate dimension where, unfortunately, bad actors are trying to reshape reality, and you're resisting it, and you're saying, this doesn't make sense. I can't take on this reality, and I'm resisting it, and there are other people resisting it. And you're right. It is wrong, right? I mean, it goes all the way back to the beginning. The alternate reality of you can't open your business. The alternate reality of you can't gather with your friends to worship. The alternate reality of your kids can't go to school, even though like it's worse for them to be home than to be at school, whatever risk. It's this alternate reality of the excess. There's nothing to see here with excess deaths.
The whole world did it. The whole world, though. I get we're crazy in this country, but the whole world, the entire world is crazy. Wow.
Dr. Drew, I mean, there's a profound amount of coordination at the world level, right? At the leaders, and whether it's the World Economic Forum, the WHO. I mean, these organizations that transcend multiple countries have leaders that get together at these, at these international conferences. So you bet it. You've seen those videos, which are, I mean, I wish everyone got to see them, where the news anchors, and there will be 100 of them on the screen, or political leaders, and they'll say the exact same thing about COVID-19 or about how they're,
and then the media too.
Right. Yeah. They say the same thing. Looks like coordination.
That's evident. That's evident. When I ask for evidence, that's the kind of thing I'm looking for. But I want you to tell me what the vaccine situation is in Florida right now. Before you do, I want to say I have no objection to the mRNA platforms. I think they're fascinating. I've been looking forward to them for a long time. I used them in melanoma years ago. They've been around for a while. I recommend the RSV vaccine. I've had no adverse events from that. But these things have to be properly manufactured and carefully, the manufacturing standards and the regulation of it has to be extremely rigorous. I don't know if the RSV vaccine is different in terms of how they're managing it, but I have a lot more comfort with that one. It's also doing something, I think. It seems to be. But what is the status in Florida? What's going on? What as a result of your concerns? What is actually going on with the vaccine on the ground in Florida?
Sure. Yeah. Well, I think it's been about 4 weeks where this issue of the DNA contamination in them led me to make an announcement that they should be halted in humans. And, I've received sometimes feedback that, the DNA contamination is in other vaccines. Why is it different in this vaccine? And so I'll just take a moment to make sure people understand why it's different in this vaccine.
Please.
It's different in this vaccine because these vaccines have these lipid nanoparticles. So they're these fat molecules, these fatty molecules. And the fatty molecules are essential for the mRNA vaccines to work because they carry the mRNA, which otherwise would be degraded when it's injected into people. It'd be degraded very quickly, and it wouldn't be able to get into people's cells to do all the fancy stuff with getting people to make their own spike protein, but it's degraded otherwise. So the fat allows the RNA to enter the cells, but almost certainly that same fat allows DNA to enter the cells. So while the FDA has acknowledged risks with DNA contamination in the past, and there have been thresholds that have been developed for that reason, the risk is different here because you're opening the front door in every cell that's around it for the DNA to come in. So it's a completely different risk analysis. And that risk analysis, we asked the FDA specifically if they have addressed it, if they've tested for DNA integration, which is one of the risks that can happen if foreign DNA is entering cells. And the bottom line is no. They had about 10,000 words and a lot of word salad and nonsense, but the bottom line is no. In Florida, fortunately, not many people are taking it, and that's a wonderful thing because they're terrible, terrible products. But we don't provide them in our county health departments anymore, so that's over. And people can still provide them, but it's something I'm talking to my team with because, there is such a thing as informed consent, and people deserve to have informed consent. So again, putting your head in the sand and pretending that everything's okay and there's no issue and there are no concerns is something that's not acceptable for any drug pharmaceutical site, whether it's CVS, Walgreens, whatever, or any hospital or any clinic to be doing. So that's something that we're thinking about how to address.
And what's the status with pediatric patients?
It's in the county health departments. We absolutely, positively do not give it. And Governor DeSantis, fortunately, we've talked about this. That actually goes back for months. I mean, he was horrified, as anyone should be, with the eagerness to administer this new technology to a population that for which there was no good proof, none benefited, no good proof for it. And there still hasn't been, right? In the clinical trials. In fact, one of the things you found in the clinical trials of pediatric populations is that the ones who received the vaccine had a higher incidence of lower respiratory tract infections like bronchitis. So they actually had more of these other infections in the vaccine group. They're completely experimental. Unfortunately, it's a bad experiment. So that's how it is in pediatrics, and we've had very little uptake. And honestly, thank God.
Well, you mean children not dropping dead all over the place, all over the state of Florida? They aren't just dying of COVID everywhere. It's the way. I remember Supreme Court Justice Sotomayor was saying there are hundreds of thousands of kids on ventilators. I'm like, oh, what have we done to people? It's really, yeah, it's incredible to me. I wonder. You and I are internists, which I don't know if people understand what that is, but we are not pediatricians. And I have you thought that perhaps the risk tolerance amongst our pediatric colleagues is very different? And maybe it should be. I'm not saying it's a bad thing, but their way of assessing risk seems very different than ours. I had a conversation with Peter Hotez, and he was flipping out about 6 cases, and they were in kids with other chronic medical conditions. And then he went on to tell me that he doesn't want COVID because there's brain shrinkage from COVID. And I walked away from that conversation. I went, oh, he doesn't understand that people our age get a lot of things like that from all kinds of illnesses routinely, and we recover typically from it at a certain age, and at a certain age we don't. That's adult, old, elderly care. That's how it works. But the pediatricians don't know this, and so they hear things like brain shrinkage, and they flip out, or they hear, or they can't tolerate any serious illness in children, even with kids with serious underlying medical conditions. Have you ever, and think about the fact that most public health officials, since vaccine sort of policy is a major feature of state level public health, most of the state level public health officials are pediatricians or non-physicians. Do you think that is creating some of the trouble with the risk analysis here?
That's a great point, Dr. Drew. I agree with you. I do think it is part of the issue. And I really admire pediatricians. They are definitely different from internists.
Oh, and they're not, very. Yeah, I don't know how to do that work. Yeah, it's very different. Exactly. But also we're different than they are. And they need to understand they're not used to making adult medicine decisions. And I'm seeing it go haywire because of that.
Yeah, and I say that without any judgment of them, of course.
No.
They're just different. And it's totally true. I completely agree with you. And it's a great point. I mean, it's something I recognize, but you named it. So thank you for that. And yeah, it is. You're totally right. And oftentimes, frankly, their approach culturally, in my observations, to conflict or differences in perception, and certainly to risk, is different, as you've said. And whether those differences extend to adult issues, I'm not sure whether they do. And I'll say something else about Dr. Hotez, who I don't know, and I don't know him, but I remember the Joe Rogan episode where he's talking about how he doesn't eat. He may not eat. He doesn't eat very well often, and he's not really exercising often. And there are a lot of people like that, and that's all good. But you can't tell me that you care about health and you care about your health and the health of other people when you're not living that. Like, I don't want that perverse version of health that only comes in a syringe, or in a pill bottle. I don't want that version of health.
Well, now you've just stepped into a big zone there, which I'm with you on. I am so with you that our reliance on pharmacology and our faith in I'll tell you, my dad was a family practitioner, And I've told other people have heard me tell this story, but I've not told you. So here goes. And he was adamant about medications are dangerous. They are serious. And it's only when the reward is clearly outweighs the risk. I was not allowed to take an antibiotic until I was like 15 or 16 years old. And I remember the day I took my first antibiotic, it was like ampicillin or something. And he brought it in little bottles, a little vial of pediatric ampicillin. And his thing was like, all right, here we go. You're going to take an antibiotic. Who knows? But your pediatrician wants you to do it, so here we go. And I thought, wow, he made such a huge deal out of something that we do ridiculously automatically these days. Not saying that he was excessive, I think, by the way, but not saying that people shouldn't take antibiotics, but the respect with which we reproach pharmacology should always be there. Understand that Tylenol can kill you. It's always doing that risk-reward analysis. And we need it because, the doctor-patient relationship has been so adulterated. We need to educate patients to make those analyses properly on their own too. I think we can do that. That to me is like the future. It's just my humble public service announcement.
No, you're right. I mean, obviously they have a role and they definitely help people, but It is important. It's not a free meal. I mean, I personally, not that long ago, came across this very good study from Denmark. I think it was a Scandinavian country that found that statins, which, I've encouraged people at increased cardiovascular risk who've had prior cardiac events to take, but there's reasonably good evidence that in women, they're associated with an increased risk of Lou Gehrig's disease, of amyotrophic lateral sclerosis. That's that. And why, and I mean, mechanistically, people can think of why. People sometimes have memory issues. There are other things, muscle cramps, other things. Possibly because of mitochondrial dysfunction, but we're complex. I mean, we're infinitely complex beings.
I agree with that.
Biologically, spiritually, emotionally, mentally, all of that. So it's just you have to respect that, and sometimes the risk, the benefit outweighs the risk. But it's wise to take it easy and look for non-medication approaches to health when possible, because the side effect profile is usually a lot better.
That's right. So vigorous exercise is the one thing that is shown to improve longevity. Peter Attia hammered that on my head one day, and everything else is sort of everything else. And giving say a statin to somebody with established coronary disease is different than giving a statin to somebody who just had a stent, or somebody who just had a bypass procedure, or somebody who's at risk, or who's somebody we don't know what their risk of cardiac disease is. Each of those is an entirely different subset of the application of a pharmacology in terms of understanding the risk benefit. I mean, it is. I'm so glad you said it's infinitely complex. I've been saying that my whole career, that biology is infinitely complex. It's not physics. It's a probability. It's a big old probability equation, and it's we're trying to. It's like predicting the behavior of clouds. We only judge, and it's why we study cases for 10 years before we start doing stuff on our own. It's because it requires judgment, and judgment is using a lot of intuition and a lot of sort of non-linear logical sorts of ways of approaching problem solving and making decisions for patients. And I'm just so glad you're in that zone. It's just so important. But let's go back to the vaccine. So you're concerned about the DNA contamination. You're concerned that the FDA has sort of blown off this. I'm generally concerned with the FDA blowing off doing the usual kinds of reviews that they do. But okay, they say they're doing some monitoring and whatnot. How do we understand, like, say, a college requiring a 19-year-old male, say, to get a vaccine to attend the institution? And I don't know if that's going on in Florida or not, but the one area that I have really grave concerns, where I just don't think it's an assailable issue that you shouldn't be concerned, that a 19-year-old male is effectively a zero risk from COVID. I mean, it's zero. I mean, it's just zero. And there's a finite risk of myocarditis that, by the way, the FDA, for some reason, elected not to notify the signal that they found on myocarditis, which is another sort of interesting mystery here. But I've certainly seen a lot of myocarditis in young males. I've seen zero serious COVID in the times of Omicron. Are people going to just start suing colleges if they end up with cardiomyopathies because they took this vaccine for no good reason? Or are schools going to continue to require a therapeutic for no good indication? What do they think they're doing? Or is that something you're looking at as a Surgeon General? It's really the area of biggest concern for me, because everything else we can kind of argue about, but this one target for me, and I think you'd include pediatrics in that too. But it's so clear that there is risk in this population from the vaccine. We can argue it's as small as we want to argue, but there is really no risk from the Omicron. What do we do with that?
Yeah. No, it's a great point, Dr. Drew. I think that I mean there are a couple things that I think about it. One thing is that the colleges obviously shouldn't be doing that. I mean, it's frankly immoral. There's no basis for it, and you're exposing people to harm without any evidence, any proof of benefit. So it's immoral. I think the other thing, frankly, that's very important about it is that I think it's the kind of thing that really can injure and fracture the soul. And what I mean by that is, imagine being in a position where you don't want to take something, but you feel like you don't have a choice, and you take that thing, and then something bad happens to you. And now you're stuck with whatever bad thing happened to you from a health perspective. You also did something that was against your will, and you felt pushed into it. That leaves a mark. I mean, that leaves the kind of mark and injury to the soul and to the spirit that has an effect, consciously or unconsciously. That's an injurious thing to do to another human being. In terms of the suing, I mean, help me, Lord. If it's possible to sue in that situation, I sure hope people can. I wonder whether it's possible. It's just because I haven't heard any cases of people doing that, whereas people have definitely developed myocarditis in that age group. But I mean, if people can sue, if that's a remedy, it should be. And frankly, if it's not, then the law should be changed to allow people to sue, especially in such a blatant situation where attribution of responsibility for harm can be so easily placed, right? It's on the shoulders of the person who leveraged extreme power to coerce you against your will and against the people in that situation. It may not even be against the pharmaceutical company. It really ought to be against the university or the hospital or the clinic or whatever the organization was that leveraged their power to force you against your own will.
Yeah, generally I brought this up lately. I'm so concerned about the patient-physician relationship and that what physicians do. We saw during COVID, because their employees, you brought that up earlier, they really behaved in ways I thought were just shocking to me. And, one of the standout moments, you mentioned Joe Rogan's podcast with Peter Hotez on it. The other standout Joe Rogan moment for me was when he got pretty nasty COVID, and he just described what he and his doctor did together to treat his COVID. He got monoclonal antibodies. He got, I think he took azithromycin or something. He got ivermectin, and he got 2 infusions of NAD. And of all the things that were sort of an outlying intervention, the NAD was shocking. I was like, really? They're giving you NAD infusions? Wow. Nobody cared about that because they were in a hysteria over the I word, an inert medication that, by the way, every refugee coming to this country is required to take by the CDC for 5 days, every single one. That's in the CDC website. And I've used ivermectin for years and years and years. I've used hydroxychloroquine for years and years. Never did I worry about the toxicity of those medications. Because hydroxychloroquine, I don't know if you know, but you know the MKSAP, I do that every 3 years. And the MKSAP 2019 rheumatology review advocates keeping women with lupus on hydroxychloroquine. It's a treatment for lupus on hydroxychloroquine during pregnancy. Because it's so inert. I don't know any other medication that I've seen that recommendation for. I don't let my pregnant women take Tylenol, but they were quite clear that the lupus patients should stay on it. So the point is, they went nutso over this one medication. It was like, for me, it's like whatever. But NAD infusions, and I talked to Joe about it afterwards, and he said he thought they helped him. I thought, well, that's interesting. That's an interesting intervention. That's an outlying intervention. So as he and his doctor wanted to do, it is outrageous and disgusting to me that anybody felt they were at their liberty to judge or manipulate or intervene on what Joe and his doctor did together. That's the purpose of my story. That this adulteration, that people feel that they should have a say in what a doctor and a patient are doing together, and that is just that is disgusting stuff.
It is disgusting, is exactly right. And the judgment is just, it's gross. And, I'll be, just to share with people, I've talked about my book a few times. And before I worked with the Navy SEAL I worked with, Christopher Maher, and I talk about that in the book. But before I worked with him, I lived in judgment. I was a being that was going around judging every person I was around. That was one of the ways that I was broken. That was one of the things that was out of sync with joy and peace and light and God's light that I carried around with me, and fortunately don't carry around with me anymore. Looking back at it, right? Judgment is this weed that grows out of the soil of people feeling insecure, people feeling, anguish, people feeling incomplete, people feeling intimidated and afraid of other people, people feeling fearful. Like that's the weed that comes out, that grows out of that soil. And it's disgusting to take that. It's too bad to have it because it corrupts the person who's judging. It's actually, it corrupts you when you're participating in that. But it's extra worse to take that and make it everyone else's business, right? It's like, here's this crap that I'm holding on to, that I have, and I'm gonna just spew it all over you. And that's the part that makes it, that's the part that makes it really gross, what they were doing to him, because of where it was coming from. And it was really, 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 really gross. It's really gross.
Yeah, don't worry, it didn't bother him. He's a big boy, but it made me. I thought from the standpoint of our profession, it was just sort of like, wow, what are they going to do next, and what are they? I don't know. There's lots of people. Everybody study your history. Physicians have gotten involved in stuff historically, not good stuff. Trust me, you can find lots of evidence of us going south with trends that were, again, back to social evils, where we think we're doing good and we participate in untold harms. I want to harken back to your judgmentalness, your judginess. Go ahead.
Sorry, I want to just say something. I hear you about saying it didn't bother him, but it's not bad for something to. It has to bother him. I mean, he's a guy that, he tries to do the right thing. He certainly never goes out of his way to harm someone. If anything, it's just the opposite for him. So of course it bothers him. He's a feeling being. Of course it bothers him. It doesn't mean it affects him in a way that affects how he shows up in the world. But of course it bothers him. I mean, it bothers you for the same reason. It bothers me for the same reason.
You're right.
Fair enough. It's good to feel.
Yeah, no, fair enough. I think important for people to be reminded that when they are the way you used to be, for instance, it lands. It lands on people. It affects how they feel in that moment, and maybe ruins their day or whatever it might be. It does land. But I want to go back to something you said about pediatricians and their approach to conflict. Were you talking about professional disagreements? Is that what you meant by their approach to conflict, or did I mishear you? Pediatricians.
No, I mean that the culture, from my observation of pediatrics, tends to be not super into conflict. And look, let's contrast that with, say, cardiologists who seem way more comfortable with conflict, with arguments, clinical decisions and data and stuff like that. And whereas the culture of pediatrics, in my observation, tends to be more collaborative. And all that is said without judgment. It just is what it is.
No, I listen. I thought that's what you meant, and I never really thought about that before. But in internal medicine and its subspecialties, and in many surgical fields, conflict is how we do business. I mean, it's how we train our youngins. It's sport, and it's just how we sharpen the edge of our knowledge base all the time, and to make sure that we're getting to an approximation of the truth. And it's shocking to me that a lot of that has been suppressed during COVID. Just shocking. I mean, it really. And I think also I'm hearing that I haven't trained residents in many years now, and I'm hearing that it's. I mean, again, I was pretty rough on medical students and residents back in the day. I was a nice person, but when it came to handing them a prescription pad and making medical decisions, that's serious business. That is like that's not time for coziness. That is, I want them to understand how serious it was. I'm hearing that's sort of calming down a little bit too, and I'm not sure that's a good thing.
And you're absolutely right. You're absolutely right. People. Sometimes this current culture would rather be comfortable than to be, aware or conscious. I should say more comfortable rather than conscious of what the truth is. That's not a good place to be. At least I don't want to be there.
Well, conscious of what the truth is, and a lot of young people are reared on the notion that the truth is just it's all relative. Truth is a human construct, and therefore it's whatever you construct it as, and your truth is your truth and mine is mine. And that is not how I was trained. It's not my understanding of science either. So I have grave concerns about, you're laughing, but I have grave concerns about post-structuralists and their impact on people's thinking right now.
Oh, hell yeah.
Okay, good. We are in total agreement about that. All right. So what going forward? Let's just sort of finish up with sort of wrapping up on vaccine therapies. What are you asking for anything from the FDA? Do you need more research to sort of bring back any sort of vaccine therapeutics for COVID? Are we just done with it? What do you imagine going forward? What are you sort of thinking about in terms of this? I'm sure you're constantly reevaluating things.
Yeah, I think that we need totally, absolutely to do responsible research. One area of responsible research is to confirm or check to determine, right? By check, I mean PCR sequencing of genomes of people who have received mRNA COVID-19 vaccines to confirm that there's no integration of DNA from these vaccines into people's genomes. I mean, that absolutely, positively should be done. We've said it explicitly. It doesn't have to be the CDC or the FDA. I mean, it should have been the FDA requiring pharmaceutical companies to do it, but laboratories can do it. Academic centers can do it. People, you think back to when we did in Florida, the analysis of cardiac death after COVID-19 vaccines. That should have already been done. We did it. People got very upset when we found that, there was I think it was an 84% increased risk of cardiac death in 30 days afterward, a relative incidence of cardiac death in young men. And there was an increase in other populations too, but that was the population where it was largest. But I mean, we did that here in the Department of Health, but academic institutions should have done it. I mean, that should have already been done. Myocarditis was already well known. It should have already been done. And so this is another thing where I hope and pray that other leaders at universities, leaders of other public health departments, leaders of other states, do the responsible thing and look at their data, do these investigations, examine whether there's evidence of integration of DNA from these vaccines into people's genomes. So that absolutely should be done. And I hope and I pray that there's more courage and integrity out there, and we don't, as a state, have to carry the lion's burden of just trying to stick up for humanity. And so that's one major thing that totally, absolutely should be done. We've said it, and no one should be taking these mRNA COVID-19 vaccines. The other ones don't have the same risk. Not saying they're perfect at all. They still don't have clinical trials that are current that apply to today's epidemiology. But at least they don't have this problem with potentially interfering with the human genome. That's just like that. There's the line, and there you are if you're potentially disrupting the human genome with your product. That's
Yeah. No, so what you were saying is you want to have categorical certainty that isn't happening. There's argumentation that it isn't happening, but you want absolute categorical certainty. And by the way, I've talked to some good this is way out of my field, but I've talked to some good biologists, some good scientists who are saying that they want to study certain tumors that may be associated with the promoter gene and look at those tumors and see if they find the sequences in the tumors, which is kind of an interesting approach, right? So that way they're not just, because again, it may be different how much DNA is delivered and what's in the batch and who gets what. And what you want to know is that there's not enough to cause a pathology, and maybe studying at the endpoint, the pathology, and then looking back may be a more efficient way to sort of cull this together. Just a thought.
Right. Yeah, I've heard that too. And I think a thorough investigation is completely appropriate. And, honestly, my gut sense is that it probably does have some degree of integration in individuals. I mostly believe that because frankly, it's partly an intuitive sense, and it fits with just about every unusual and unfortunate thing about these mRNA COVID-19 vaccines. So that's my sense.
Well, all my career, it's been about squeaky wheels and people standing up and questioning things and being willing to be wrong. That we always admired anybody that did that. So I admire you by my sort of history and my nature. And if you are right, God help us. In your concerns, and until we do the right testing, I don't know how we can have certainty. We have a time. One of the things that Fryman said to me that I will always walk around, or at least for the intermediate term, walk around with. He said, we live in a time of irrational certitude. Irrational certitude. And he goes, we as, well, he's right. He goes, we as physicians and scientists are trained to be rationally uncertain at all times. I'm always uncertain. I'm rarely clear. Right. So it's a rational uncertainty. He goes, but there are people everywhere that have irrational certitude. They're certain they're right. And that is not rational, as you said, in the infinitely complex being we call the human.
That's it totally. How about that, huh? Flipping the head on its tail. Irrational certitude. He's AKA propaganda, AKA give me a break, AKA listen to Dr. Drew.
I listened to Dr. Ladapo, and I was in your great state a couple days ago, and I didn't see anybody sick. I didn't see anybody dying. In fact, I saw an unusual amount of engagement and business activity and happiness and thriving. Certainly don't see that in this part of California. But congratulations on everything, and say hi to your wife for me. I interviewed her a couple months ago. She's a lovely woman and got a lot of really interesting things to say. And everyone go get Dr. Ladapo's book. It is fascinating, and I suggest if you like the conversation today, you will like the book even more. There it is, Transcend Fear. Follow Dr. Ladapo on X at FL Surgeon Gen, FL Surgeon Gen. And I want to come out to the northern part of the state and shake your hand one of these days. That is one of my plans. So thank you for being here.
Yeah, thanks, Dr. Drew. Thanks so much. Thank you very much.
You got it. It's Joe Ladapo. He was very kind with his time. Caleb, I know there's people with hands up on the Twitter Spaces. I don't think they really want to talk to me. They probably want to talk to him. So I was working. Are you there, Caleb? I was working on whether or not I should do that, and I just thought, I know how that's going to go, and I don't know. I don't know that would get us anywhere. So I'm looking at the restreams and whatnot to see if there's anybody have anything there. Yes, people worried about the SV40 and promoter enhancer. It maybe not, Michael Nuss, maybe not. That has to be proven is the issue. And then on the restream, oh my goodness, it's moving so quickly. Dr. Ladapo is fantastic. I had a chance, JK says. I don't know what the chance is, my friend. Again, we treat our guests as guests here. They come in, they graciously come here for an interview. I treat them as a guest. I listen to what they have to say. You should listen as well. You can agree or disagree. You can listen to many, many other opinions. And my job is not to prove or disprove things that people say here. I know when Naomi's on here, people get very upset oftentimes because she says stuff repeatedly that is, I mean, it's tough to prove some of the stuff that she says, but I'm sitting, I'm listening to her and seeing what she has to say. Hang on a second. Emily Barsh is getting upset about something. Caleb, do you know what that is? Anybody?
Not sure.
Hold on a second. I hear the baby's for you, and now you got to get going.
Yeah, you hear him.
So hold on.
These mics are really good.
Yeah. Well, babies are loud. All right. So we will leave it at that. And by the way, if people would like some other opinions, I'm happy to take other interesting opinions. We, have had, like I said, I interviewed Peter Hotez. I've interviewed, I'm blanking on the woman that's advocating for vaccination.
Dr. Vicky Mail.
Pregnant woman, Vicky Mail. I'm happy to bring people in here and hear what they have to say and just sit and listen carefully to their stuff as well. We've had him here for sure. And I will happily listen to people's opinions, and I'm still formulating my own, as you should be too. It's hard with the information available to know exactly what's going on. Dr. Fryman, I'd like to get him back. He, to me, is sort of the best analysis of some of the flawed data that we have. He really does a very good job of asking the right questions and looking at the endpoints that we should be looking at. These are hard things to do. All right, so let's wrap it up. My dogs are getting anxious here as well as your kids. Larry Elder in here tomorrow. Roseanne next week. Del Bigtree you guys want Del Bigtree? We're bringing him. That's another, sort of very extreme opinion. Nikki and Jim Norton are going to be in studio on February 8th. They are a delight. I think you're going to like that. Alex Berenson, when Kelly Victory joins us again on February 14th. Zuby's going to come around the 15th. A lot of interesting opinions. And as I said, contact@drdrew.com if you'd like to suggest some other folks that we want to bring on in here. And we do appreciate you being here. Do subscribe, if you don't mind, over at Rumble. It helps us a great deal. And follow at Ask Dr. Drew. That is on X, correct? Is that X? Yes, X.
Yeah, that's correct.
And they'll get updates on shows and whatnot there. So, all right, thank you all for being here. And we will see you tomorrow. Tomorrow we have, as I said, Larry Elder at 3 o'clock Pacific time. We'll see you there. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.